Welcome back to Studio Chatter. Breast cancer is the #1 cancer killer of women in the world. What can we do to get in front of this disease? Welcome Shelly Mitchell, the imaging manager at the Spanish Fork Hospital, to the table. Welcome.
Hi, Shelly.
Hello,
Thank you.
Shelly.
Hello.
So super important.
Yes, it is, and we're coming up on the biggest month of the year for breast cancer awareness.
Right. Yep. I actually just got a little bit of a jump on mine, and it's not the most pleasant exam.
You had a little bit more intense, I guess I could say.
It was a little more in depth, yeah. So on one of the girls on the right side, just a little suspicious. So just a little bit more with the ultrasound, just to get a more of a look, and then to go back again in another 6 months. And it really is just so important because you just never know. And then while I was laying there, actually it was my annual. So it was just the regular first, and then we're just watching the right side. But everything's fine. I'm good.
Oh, good. Okay, that was the end of the story.
Yes.
She's fine.
Yeah.
So tell us a little bit about you and how you, I guess, started with the hospital, or what your career's been. Yeah.
So as managing of the imaging department, that's all diagnostic imaging. So X-ray, CT, MRI, mammography. I've been with Intermountain for just over 4 years, but I've been in imaging for about 32.
Wow.
So
an expert in the field.
So I've been in this for a long time, and my first specialty right out of radiology was mammography. So it's something that I know exactly what you're talking about from both sides, as a patient, but as well as on the professional side. So I know how scary that can be for women. And it's scary enough that women will put off their screening mammograms. So if there's one message that I can share today is get those screening mammograms.
Do you think it's scary for the unknown? That people have never done it? Like once you've gone in once, I mean, we know what we're in for now, so it's not scary. For me,
And maybe embarrassing a little bit too.
Yeah, what do you think to hold back?
I think there's several. One is it's all the people that go home from having their mammogram and say how awful it is. That's one of the things in imaging. Mammography, MRI, those are two of our specialties that people go and tell their friends and their family and their neighbors how terrible it was.
That's
and then
true.
And it scares people. They're like, oh, I went for a mammogram and it hurt, and so
and
I don't want to go.
But it's not like
it's uncomfortable,
right?
And
but I think that's our way to like process it when we're probably overreacting a little bit.
Right. So I get it. It's scary, but there's a lot of things as women that we do that are scary.
True.
But we do them anyway.
Right.
Isn't having a baby scary? But
Yes,
it doesn't stop women from having babies.
Yes.
Well, and isn't it good to have the knowledge of what's upcoming, or to be able to stop it, or do something about it?
Right. So I don't know if you guys are familiar with the statistics, but unfortunately in Spanish Fork, screening mammography is really underutilized for the population in Spanish Fork.
Good to know.
We've got about a 35% higher incidence of a death rate. The death rate is about 35% higher in Spanish Fork than the rest of the state, and about 40% higher than the nation.
Interesting.
Wow, so what do we need to communicate to our viewers?
Accessing screening mammography.
I feel like having the hospital and a facility like this closer now may increase that, because I know I used to have to go up to IHC in Provo, and it's a to-do. Like, it's a little more of an event, where I feel like if it's closer, maybe that can be helpful.
Let's hope us being here and having a presence in the community will encourage more women to do so.
Right.
As we mentioned, we are coming up on Breast Cancer Awareness Month in October. So right now is a really good time for women to get their friends, get their sisters, and let's make our appointments together. One thing I can tell you that I don't know for how long this will be, but because we're new this year, our volumes at Spanish Fork have not yet been where we're at capacity. So walk-in mammography, we are offering that every day right now.
Yes,
Totally.
it is.
So get the bravery up, just run down.
Yeah, if today's the day that you're feeling a little extra courage, then just walk in. We've got walk-ins. And I suspect that it could be that way even through October, as we have tried to ramp up our staffing to prepare for a busy month. So walk-ins, and we are allowing people to call straight to our department department. Usually we use a central scheduling with Intermountain Healthcare, but for the month of October, and because we are new this month, you can call straight
Okay.
to our department. So there shouldn't be too much of a delay in getting through the scheduling process.
And can you
That's
walk
awesome.
us through maybe the process? I think a lot of people
Sure.
are scared of like, what's going to happen to me, exactly how it goes down. Maybe that'll help people when they know.
So first is either an appointment or walk-in, right? One thing that I do love about our department, because it's new and we were able to design, we have an area where women can go into a mammography waiting area, so they're not out in the main waiting room. So your neighbor's not going to come up and say, "What are you doing here?"
Same thing you're doing here.
Exactly. So we do have a dedicated waiting room. Mammography, again, the unknown is scary. So when a woman comes in, we have them step into the change room. They disrobe from the waist up. We have robes, not usual hospital gowns. Sometimes those are a little bit revealing. And so we have gotten, at Spanish Fork, we have gotten some special robes that
love
women
that.
are able to put
Oh,
on.
like
It's
the
a little more,
capes.
a little more comfortable.
Yep.
So make kind of a little more of a spa feeling. So we just want to do something a little bit different and make women feel a little more comfortable. It is only you and the technologist in the room, so it's not as though there are like a lot of people stepping in and out. Depending on what you're there for, if it's screening versus diagnostic. So screening is always you don't have any symptoms. This is really just an annual, part of your annual checkup.
Okay.
You're not feeling any lumps. You're not feeling any discharge from your nipple. There's not anything that you're questioning of concern. Really, it's just for the mammogram.
Okay.
And then if it's a diagnostic, that sends you down a different road. So I have a lump, that's a different kind of, it's a mammogram, just the same, but it kind of sends you down a different pathway.
Okay.
A little more in-depth.
A little more, yes.
Like maybe
And-
more Natasha.
And we are actually, so with your experience, Natasha, we're not doing diagnostic mammography at Spanish Fork right now.
Oh, okay.
Because it requires a radiologist on site at the time those are being done, because they took your images and they said, oh, what more do we need? And we need a doctor on site to be able to do that. And to be able to take you right into ultrasound and get that ultrasound. So right now, starting out in Spanish Fork, we are only doing screening mammograms. It's another reason why we're able to do walk-ins.
Yeah. Okay.
Because our
Just keep
schedule,
that
because it's
flow.
just the flow of just the
Because waiting for the ultrasound is like, it's a wait. I mean, you're laying there. I was texting these two while I was waiting. I'm like, I'm just laying around.
Yeah, and I have walked in and out of a mammogram in maybe 20 minutes once.
Absolutely.
Like it was
Mine too.
really slick.
When we get busy, so I said I'd been with Intermountain for just over 4 years. I was in Orem before, and in the month of October, we schedule every 15 minutes for our mammograms.
Wow.
Pretty fast.
So we try to have two technologists so we can turn the room around and get people in and out.
Is the hospital, sorry, Natasha.
Oh, no, I was just going to ask about recommended age. Because
Absolutely.
that varies. I mean, I don't know if that's varied through the years, but didn't it used to be 35? Is it still 35?
They used to say a baseline.
Okay.
So now it's really at 40.
Okay.
Annual mammogram at 40.
Even with a history, like a family history?
So family history is very interesting. It's not as prevalent.
Okay.
And this is an interesting statistic, only about 80% of breast cancers are actually in women who have family history of breast cancer.
That is interesting.
80%?
My family is family.
About 80%, or I'm sorry, I hope I said that right. Only about 80%, or less than 80% of those that have breast cancer actually have a family history.
Okay, that's what I was wondering. I'm like, that's a lot.
Yes.
80%.
No,
Like
no,
20, so the 20 percentile is the ones that
80% of breast
actually
cancers
do.
found, there's no family history.
Okay.
Wow.
So,
Annual mammogram is extremely important. At age 40, you should be, if you're healthy, you should be getting them every single year.
Okay, yep.
okay.
Yeah.
And is the hospital offering anything in October for awareness?
incentivize?
Yes, we do have some gifts, and one of the favorites that
We should have waited.
I don't know if you're familiar with V chocolates, but it's something that that we've kind of made a tradition in some of the facilities that I've been at, and so we'll be doing V chocolates along with a small gift. in
All
October.
good things come in a little blue box.
Right? These will be pink.
Oh, of
These
course
will be
they
pink
be.
boxes.
Okay.
Packaging.
Oh,
And then
love
what
it.
about insurance coverage?
Insurance is really interesting where we've come. Most of them are paying for 3D mammography now, which is really fantastic. And as long as you're going to a facility that's within your network,
Okay.
then you're really
good.
good. You don't even need a physician referral.
Oh,
so you don't
really?
need an order written. Nope. That's why you can walk in and you don't have to wait for your doctor to send you an order.
nice.
That is nice. I'm
And they
glad you
send the
clarified.
results to your doctor, but you don't necessarily
The
need their
exception
permission.
for that, I should say, is diagnostic.
Okay.
But screening, no, you do need a physician for us to send a report to, but
Okay.
you don't need an order from your doctor.
Okay, that's good to know. This is great. We need to have you back again. There's
Let's do
so
it.
much to chat with you
Yeah,
about.
I agree.
Well, we would be happy
We
to come
scratched the
back.
surface today.
Yes, good. Check the tatas, right? There's more studio chatter coming up.